I had the most intense headache.
Fever, muscle aches, pain everywhere.
You're unable to breathe unaided, lungs completely taken over.
I am going to get better.
I am on the other side, and you're looking at the face of a COVID-19 survivor right now.
Hello and welcome to the Nexus once again. Now, as we watch the number of cases and deaths from coronavirus rise, we want to make sure that you are prepared. And whether you're in a so-called vulnerable group or not, there are some things you need to know. For example, how bad do your symptoms have to get before you call an ambulance? Is it more dangerous to go into hospital than to stay at home? And how are the doctors going to help you, assuming they have the equipment? In a moment, we'll hear from a consultant dealing with patients at a London hospital. And we'll hear from two women who beat COVID-19 last month, one in Lagos, Nigeria, the other in New York. But first, let's hear from a survivor in London. Here's Tara Jane Langston's story.
Please, none of you, take any chances. I mean it. Because if it gets really bad, then you're going to end up here.
It doesn't matter what gender you are, it doesn't matter what colour you are, and it doesn't matter what God you believe in. Nobody is immune to this.
I got ill a week before I came into hospital. I was just at home trying to recover. And then it hit me. Couldn't breathe, couldn't stop coughing.
Every time you take a breath, it's like glass. I was in the ICU for 3 days. I actually thought that I was going to die.
I am recovering really well. As you can see, I'm breathing better. I'm not coughing. I cannot wait to get home to my girls and my husband.
I was in the hospital for a total of 9 days, and I returned home, which was the best Mother's Day present ever. I returned home on Mother's Day to my family.
Everybody, please take care. We're all in this together.
Now, Tara's situation, her condition was so bad that she had to call an ambulance and go to hospital. And that's the crucial question here. How do you know when you should call the emergency services? Now, we're going to be bringing in our first guest now, Dr. Shamaz Ladani, who's a pediatric infectious disease consultant in London. Now, Dr. Shamaz, we have on the screen the most common symptoms of COVID-19: fever, dry cough, fatigue, sputum production and shortness of breath, etc. Many sufferers will have these symptoms, but for a minority, around, say, 15 to 20% of cases, people will have severe symptoms. Can you just tell us when someone should decide, you know what, I can't ride this out at home on my own, I do need to call the emergency services?
So COVID-19 is unlike many of the other infections that we have seen. And one of the things that's clear is that it takes several days to get better, and often the deterioration occurs a week to 10 days into the illness. So even though you may be well in the beginning, if you feel like you are deteriorating and getting worse over the course of a week, then you should seek medical advice. That may be just phoning your health center, but if you're not happy with that answer, then you should try and get medical help quicker rather than later.
And one of the things you mentioned when we were setting up for the show is that people should watch out for signs of hypoxia. What is that, and what are the signs?
One of the major symptoms that we're worried about is hypoxia, which is essentially not getting enough oxygen into the body. And that's just because the respiratory system is affected so badly by the infection, and more importantly, the immune system trying to get rid of the infection in the lungs, that it doesn't allow for the exchange of oxygen and carbon dioxide. And so hypoxia is basically a sort of a suffocation feeling. Often people complain of having like a panic attack because they just can't get enough air into their lungs to breathe.
And Dr. Nadani, it's obviously not possible to diagnose oneself exactly, but what should one look out for? What are the indicators that you might be suffering from hypoxia?
So the biggest concern really is that you are not able to do your daily activities. It depends on your age. The important thing to remember is that even the older adults are more likely to suffer the severe symptoms of the novel coronavirus. Actually, children, adults, and even healthy individuals can also get severe symptoms, and they need to be aware as well. And there comes a point where they really can't look after themselves at home, and they need to make their way to the hospital.
And they might feel more confused than normal, may not be able to even feed themselves. Is that right?
So in older adults, hypoxia can be very subtle. You can have people who actually feel very low energy. They cannot get out of bed. They are not moving. They can feel dizziness with it, and they can actually, like you say, get very confused and not know where they are or what they're doing. Clearly, the other problems with older adults is, if they're unable to feed themselves or look after themselves, then they need help, and it may be that they need to go to hospital for that.
Now, in these circumstances, you advise that people should call the emergency services, but of course, some people are quite concerned that the first responders themselves might actually bring the coronavirus into their homes. After all, they've been seeing patients and coronavirus call-outs earlier in the day. What precautions are the paramedics taking?
So in most countries, there are very, very strict guidelines for all healthcare professionals, not only to protect the community, but to protect themselves as well. In general, the paramedics and the ambulance crew that come to the house and who have contact with people should be adequately protected, not only for themselves, but also the people they're looking after. And when they finish contact with the patients, they would strip and have new outfits for the next patient. So ideally, there should be no contact with patients between one house to another when they move, because you really do not want to transmit coronavirus in this way.
I think that'd be quite reassuring for many people who might find themselves in those circumstances. What about at the hospitals themselves? There have been reported cases of people with other illnesses, for example, cancer. They're undergoing their usual treatment, their usual visits, and they've picked up the coronavirus there. What are hospitals doing to reduce that risk?
So different hospitals in different regions have their own protocols about how to do that, how to manage it. In some countries, they have hospitals where only the coronavirus patients are being admitted. In others, they are separating the hospital into different areas. So some areas would only have adults with respiratory infections coming in, and then they're tested for coronavirus to see whether they should be separated from those who have other respiratory illnesses. And they try and maintain services such as maternity wards and pediatric wards completely separately so that there is no mixture of patients who might have COVID.
And do you think these measures are effective?
They are the best that we can do given the facilities and the resources that we have. What we are looking at is something that is completely unprecedented just in terms of the numbers of cases coming through, the number of intensive care and deaths that are occurring. It is just not possible to do any other way. We are trying to work harder. We are trying to build resources. So large hospitals, you've heard about stadiums being converted into hospitals. Those are all attempting to keep the coronavirus patients separate to those who are coming in for other medical illnesses. And it's just been 3 months since this has all started. And in the UK, it's been less than a month that we've been seeing such a huge increase in cases. So it's happening very, very fast, but we are trying to build the capacity to try and separate them.
Now, there have been a number of newspaper headlines where medical staff have actually been complaining that they do not have adequate PPE, personal protection equipment, and complaints that they've been prevented from even talking about it. Have you heard anything about that?
So clearly, we've all heard about the complaints. We know that the frontline staff are struggling to get enough PPE, and therefore I'm not sure how they've been stopped from talking about it. I think it is a well-known fact. The problem is that everybody's trying very hard to try and get supplies of PPE, but every country is in exactly the same situation and they're all struggling with exactly the same problem.
Now, we've also heard of paramedics and first responders going on the record as saying their working conditions right now are absolutely exhausting, not just in the UK, but in other countries. Let's have a quick listen.
Yesterday, I worked 16 hours and I had 13 cardiac arrests. That's a lot of death.
Évidemment, on a tous peur de donner le virus à nos proches. La fatigue, oui, elle se fait ressentir tous les jours.
It is scary, but we sort of have a duty to our patients, so it is the split between looking out for my own safety, but then also I'm a nurse, so my patients come first.
I don't know if any of us will ever be the same after this. And that's something we're going to have to manage. There's going to be a lot of trauma from this for the medics and EMTs who have seen this all, unfold, firsthand, being on the front line.
Now, we're going to talk further with Dr. Ladani later in the programme when we discuss what kind of treatment and help you can expect to get in hospitals, including when is it appropriate to use a ventilator. But first, let's bring in two more people who have survived COVID-19. Diana Berent from New York and Oluwaseun Ayodeji Osowabi from Lagos, Nigeria. Now, Oluwaseun, your story is a very interesting one. You're the Young Commonwealth Person of the Year and you were attending a Commonwealth event in London. There's Prince Charles there meeting you. And you actually think that you got it during your stay in London. What makes you think that?
I wouldn't say I got it during my stay in London, but I actually got my symptoms on the day of my return back to Lagos. I was in flight when I started exhibiting, high temperature, fever, and all of that. So it was just as I was about to leave the UK that I started feeling the symptoms.
Yeah. And what were the worst symptoms for you? And at what point did you decide that you needed emergency help and you needed to call an ambulance?
At the point when I was seriously coughing, my temperature had gone high. I was experiencing loss of appetite. I had diarrhea as well. I knew that there was something wrong and I needed to test. So I contacted the Nigeria Disease Center, Control Center, to get tested to check if I had COVID or not.
And what is the experience for you in calling the emergency services in Lagos?
Yes, I called up the center and immediately someone responded to me and said I would be tested at home. And, the next day, medical officials did show up to take my test in the house.
Right. And what was the worst part of when you were fighting this infection in hospital? What was the worst part for you?
The worst part for me was basically having diarrhea, vomiting, struggling, to retain food and water in my system. I had back pain, I had nausea, I had everything going on with me. So that was really the worst part. And I even lost my sense of taste. So I couldn't eat, but I had heightened sense of smell. So I could smell water. Every food in front of me was irritating me. It was a very, very tough period.
And how long did it take from being identified as having picked up the infection to the end of it, the end of the symptoms?
I was in isolation center for 2 weeks. So if I count the number of days in the center and the number of days I initially had the symptoms, so that's roughly about, let's say about 16 to 17 days.
And tell me, are people taking this seriously in Nigeria? Are they following the government guidelines?
So, we are encouraging more people to take it seriously, to stay at home, to practice social distancing so we can stop the spread. I just want to speak to the importance of people respecting the government lockdown because for the benefit of all persons' health.
Oluwaseun, thank you for relaying your experience of having COVID-19 in Nigeria to us. I know that you're suffering from a power cut right now and your battery is about to die. So thank you once again and look forward to catching up with you in the future.
Thank you so much for having me.
Well, let's move on now to Diana Berent in New York. Now, you were infected during a business meeting in the city last month. And since recovering, you've donated your plasma to help others survive. Just tell us, how does your plasma help other people to fight this disease?
When I got the virus, my body reacted by producing the correct antibodies to fight it off. Not everyone is that lucky. So as a survivor, I have what's almost an internal hazmat suit built in. And that's a superpower that I can share with others. I just got cleared on Monday to be as free of the virus and positive for the antibodies. And as icing on the cake, it turns out that I am a universal donor. So as my doctor said, my plasma is liquid gold. It is turning out that the virus is staying in people's system for much longer than we initially suspected. And the reason that we're finding that out is because the only people right now in the United States who are getting retested on the back end of the virus, even those of us who had positive diagnoses at the beginning, are those people who are going to donate plasma. They are requesting that people come in at 14 days at a minimum, but at 14 days, almost everybody is showing up, is still having the virus. And so we're really looking for people who are 21 to 28 days out.
And Diana, how many people can one donation actually help?
Right now, the scientists are telling me for every donation, you can save 3 to 4 lives, and you can donate every 7 days under new guidelines.
And now you've set up a Facebook group called Survivor Core, and you help survivors connect with each other and with the scientific and medical community more broadly. How is this group helping in the fight against COVID-19?
So we are living in the wild west of medicine right now, and scientific researchers and medical researchers need survivors because so many of the answers to this virus lie in the bodies of survivors. So it's giving our blood and our plasma, but also doing research to figure out how long we are contagious for, how long we're shedding the virus, what are the methods of contagion, how do certain drugs react to the antibodies in our system. And by creating an efficient platform, we are flooding every single one of these studies with more volunteers than they can handle.
Well, that's good news. I understand that you're even receiving correspondence directly from different parts of the United States and perhaps elsewhere, asking for you to be flown to their area so that you can donate plasma to help them.
On the Facebook group, there have been more individual solicitations going out than I could possibly count. And we get those right to the top because we also have people who are answering the call. I saw the most beautiful post as I went to sleep last night. It was a woman in the group who made an announcement saying, "Great news, I just tested negative for the virus. I have the antibodies. This is my blood type. Tell me where you need me. I will go anywhere you need me. I will donate." I mean, it brings chills to you. I mean, to think that it's rare in a lifetime to be able to save a single life. We as survivors truly can band together and not just as an American community, but as a global community to help stem the tide of this pandemic.
Diana Barrett, thank you so much for sharing your experience here on The Nexus. It's a really hopeful story, and we will be discussing it, the use of plasma a little further with Dr. Ladani in a moment. Thank you once again. Appreciate it.
Thank you so much for having me. I really appreciate it.
And Dr. Ladani is back with us as promised to talk about the kinds of treatments you can expect in hospital. Dr. Ladani, as I understand it, the two main causes of death related to COVID-19 are respiratory failure and then multiple organ failure as a result of your immune system going into overdrive. Let's deal with how hospitals help people deal with respiratory failure because of the COVID-19 attacking the lungs. How do hospitals help people breathe? What are the stages, the main techniques they use?
So the majority of those who end up with COVID in hospital generally just require a little extra oxygen, which can be given with a face mask that delivers a high concentration of oxygen into the lungs. And that helps relieve this feeling of breathlessness and makes them feel better. And it's just a matter of waiting out the infection because we have no treatment for it. And therefore, all we can do is provide supportive care to whatever systems that need helping. So in older people, they may need nutrition. They may get a secondary infection and they may need antibiotics for that. But the main thing really is to provide oxygen for the lungs so that they can breathe better while their infection is healing.
If the oxygen mask is not enough, you then have to move on to what is it called, a CPAP mask, where it forces oxygen into your lungs. Can you tell us about that?
Yes, so that would be the next step. And you are now getting into heavy machinery, which is limited in any healthcare system. And that's what they're trying to build capacity for. The reason is that if you just cannot get enough oxygen into the lung by breathing, then you have to support that further. And there are various mechanisms trying to force oxygen down into the lungs, which help the breathing. And one of them is a CPAP. CPAP essentially stands for continuous positive airway pressure. So it's literally a very tight-fitting mask around the face that drives air down into the lungs and pushes it into your body. And a lot of them will only need that. And if they get away with it, then they're very lucky because it just stops them going onto a ventilator.
Well, that's the last and final hope, is it? The ventilator. Tell us how that works.
So there is one more after the ventilator called the ECMO, and we'll come to that in a second. But in general, by the time you need a ventilator, you are very, very sick. And then you have to be put to sleep with medications and connected to a ventilator through a pipe into your throat that drives oxygen into your lungs. The reason that you need to do that is the pipe is very uncomfortable, and you cannot be awake with the pipe in it because it just causes a gagging reflex. The ventilator can be set to deliver very high pressures and very high oxygen into the lungs, and it allows the doctors to better control the respiration for the patient who's very sick. And then there is the ECMO, which is a very invasive procedure where we bypass the lungs completely and the blood is oxygenated by a machine outside the body. Now that carries a very high risk in terms of procedures, and it also carries a very high risk because it means that you have very severe illness. But those are only available in very few facilities around the world.
We also talked about another cause of death where the immune system goes into overdrive and causes multiple organ failure. Is there any treatment that can handle that?
There is at the moment no recommendation for any treatment because we don't know any treatment that works against coronavirus. Now, the problem with this infection is that after a week or so, our own immune system goes into overdrive, and our immune system then tries to attack the virus in the very places in the lungs where we're trying to breathe. That makes the breathing even more difficult. Once you are going into respiratory failure and you cannot breathe on your own, then your other organs will also start failing because they just don't have the capacity to maintain their normal function. So it's very common that if you're going to go down that route after your lung failures, your liver may stop working and you go into liver failure, your kidney can stop working and you can go into kidney failure. And those are all very bad signs for recovery from coronavirus infection.
Final question for you, Dr. Ladani. We heard earlier in the program from a woman in New York who is donating her plasma, which will be used to help other patients recover. Can you just explain very briefly how that works and how viable it is in the fight against COVID-19?
It is certainly one of the promising treatments if it is shown to work, and we do use that for many other illnesses. So basically, anybody who recovers from an infection has antibodies against that infection, and they make a lot of antibodies just after they've had the infection. And what you can do is take out those antibodies and you can give it to somebody who is sick, and that will mop up the virus from the body and get rid of it. The problem is that we need to make sure it is safe first. So it needs to have proper testing, it has to undergo proper clinical trials, and if that is a viable option for treatment, then I'm sure that that will be another possibility that we could use for the more severe cases that are in intensive care.
Dr. Ladani, thank you so much for your contribution to the Nexus once again, and thank you at home for watching. You know, we've talked a lot about people who have made it through this illness. We'd like to leave you now with a tribute to the medical professionals around the world who have helped them survive COVID-19. Till next week then, goodbye.
Thank you, doctors and nurses. You're all superheroes.
Hey everybody, a huge thank you from Delta Hospital. Thank you for all the love and support. We really feel it here.
We're not here tomorrow. We're grateful for today.
Yes.
Amen.
Amen.